Elevated intraocular pressure and its treatment. Elevated eye pressure. Ocular hypertension is defined as a health condition in which the eye pressure is higher than 21 mm Hg, in addition to other conditions that must be fulfilled and will be presented later, and in the context it must be mentioned that there is a fluid in the eye produced by ciliary bodies, similar to water and called aqueous humor, and the function of this fluid is limited to nourishing the eye and maintaining its pressure, through its flow to the front part of the eye, behind the cornea and in front of the iris, through a spongy network called the trabecular meshwork, and if the eye is healthy and intact, a small amount of this fluid will enter the eye in exchange for an equal amount of it flowing out of the eye, and most of this fluid flows out through a drainage angle in the front iris, and this equal flow contributes to maintaining the stability of the pressure inside the eye. In some cases, an imbalance in this flow may occur, which leads to the accumulation of fluid inside the eye, causing an increase in intraocular pressure. Symptoms of raised eye pressure. The rise in intraocular pressure is not accompanied by any symptoms or signs. Therefore, it is usually recommended to conduct periodic eye examinations to ensure that the pressure is within the normal range, and high intraocular pressure is one of the most important risk factors for developing a disease called glaucoma or glaucoma, and this disease is represented by damage to the optic nerve in addition to loss of field of vision. In the context, we mention the conditions that must be met to diagnose high eye pressure. The intraocular pressure is more than 21 milliliters of mercury, in one or both eyes. No signs of glaucoma appear when a visual field examination is performed. Nerve fibers and optic disc are not damaged. The drainage corners in the eye are not damaged. Not having any health problems that may cause high eye pressure, such as uveitis. Causes of high eye pressure. The imbalance in the drainage of fluid inside the eye causes an increase in intraocular pressure, due to a defect in the channels that drain fluid from the eye, where the eye produces fluid naturally, but it cannot be drained, which leads to an increase in this fluid in the eye and thus high intraocular pressure, which increases the chance of developing glaucoma or glaucoma. Knowing that there are many cases in which the intraocular pressure rises without developing into the stage of glaucoma, and to return to talking about high intraocular pressure, it should be noted that in some cases ciliary bodies produce large amounts of aqueous mixture. This increases its amount in the eye, which leads to an increase in pressure inside the eye. Factors that increase the risk of high eye pressure. Although high eye pressure affects people of all ages, there are many factors that increase the risk of developing it, including a family history of glaucoma or high eye pressure, age over 40 years, having diabetes, the incidence of severe myopia, belonging to the African race, take some types of medication, such as steroids, the eye was injured, incidence of certain health conditions, such as syndrome cluttering dye, pigment dispersion syndrome, and the arc of the cornea, corneal arcus, and the syndrome desquamation, false reduction of blood pressure. Diagnosis of elevated eye pressure. Ophthalmologists conduct tests to be able to measure the pressure inside the eye in addition to other tests to diagnose and evaluate the condition. These tests are mentioned below. Visual acuity. Test aims at conducting this test to assess vision in principle, and the optics specialist to conduct this examination request from the patient reading letters using the scheme eye. Examination of the front of the eye. The front of the eye that includes the cornea, anterior chamber, iris, and lens is subjected to this examination using a special microscope called a slit lamp. Optic nerve examination. This is to detect damage or disorders affecting the optic nerve, and pictures of the front surface of the optic nerve may be taken as a future reference for comparison later. Tonometry, nose. One of the methods used to measure the pressure inside the eye through a tool known as a scale of tension, in English, tonometer, where the patient is placed in the eye of a drop of narcotic and apply light pressure on the eye. Examination of visual range, visual field testing. Conducted this test to examine the peripheral vision and aims to exclude any disturbances in the field of vision due to the incidence of glaucoma, as there may be a need to repeat this examination. In the case of low probability of infection damaged glaucoma 2 can test procedure time 1 in a year, but in the event of a high risk of this damage, it should be performed regularly every 2 months, and it is performed by an automatic machine. For the visual field, gonioscopy test is conducted to examine the discharge of the eye angle, to determine whether the angles are open or closed or narrow, to the exclusion of other cases that may lead to high pressure in the eye, and as this test put a certain lens in the eye. Corneal thickness examination, pachymetry. This test is performed by a probe installed in front of the cornea to determine its thickness, as the thickness of the cornea contributes to determining the pressure inside the eye more accurately. As a cornea that is thinner than normal may give false low pressure readings, while a thicker cornea may give false high pressure readings. Treatment of high eye pressure. The main goal of treating high eye pressure is to prevent the development of the condition of developing glaucoma or damage to the optic nerve, as the doctor begins to follow the treatment plan directly for people who are most vulnerable to glaucoma, and accordingly it can be said that the treatment of high eye pressure varies from person to person based on the health condition. When the eye pressure exceeds 21 milliliters of mercury, the doctor may be satisfied with monitoring without resorting to the use of any drug treatments, while he may prescribe drug treatments in other cases, depending on the risk factors of the patient and the results of his examinations. And it is worth noting that in the absence of prescription drug treatments, it is worth directing the victim to continuous monitoring. Medical follow-up. Some cases of high intraocular pressure require re-evaluation and medical examinations periodically and continuously, especially for people prone to developing glaucoma, as they must measure eye pressure frequently, and eye pressure is evaluated based on the following instructions. If the intraocular pressure is 28 milliliters of mercury or more, the doctor usually resorted in these cases to the use of drug treatments, and the patient must see a doctor after a month of using the drug, to investigate the effectiveness of the drug in reducing eye pressure, and to detect any side effects that may be they are caused by the treatment, and in case the treatment has proven effective, other appointments are scheduled to review the doctor and evaluate the case every 3 to 4 months. In the event that the intraocular pressure ranges between 26 to 27 milliliters of mercury, the doctor prescribes treatment, and the examination is repeated after several weeks. If the pressure remains within 3 degrees of the first reading, the doctor sets periodic appointments every 3 to 4 months, in which the intraocular pressure readings in the second visit are less than the reading at the first visit. The doctor determines periodic reviews at longer periods. It may be at least once a year, and during these visits the visual field and the optic nerve are also examined. In the event that the intraocular pressure ranges between 22 to 25 mm Hg, the examination is repeated within 2 to 3 months, and if the pressure is within 3 degrees of the first reading, the doctor sets the other appointment after 6 months, and the examination includes testing of the optic nerve and the visual field. Pharmacological treatments. In some cases, the physician prescribes, As previously mentioned, medicinal treatments, topical eye drops to help reduce pressure inside the eye, and in some cases the doctor prescribes several types of drugs at the same time, and the doctor often recommends using the drops in one eye to check the effectiveness of the drug in reducing pressure inside the eye, and in case the treatment has proven effective, the doctor recommends using it in both eyes, and it is worth noting that medical follow-up should begin immediately after starting the treatment, and the date of visits is determined based on the type of drops the patient uses, as some of them do not show their effectiveness until after 6 to 8 weeks, such as latanoprost, travoprost, and bimetoprost, bimetoprost, but usually the first visit is after 3 to 4 weeks from the start of treatment, in order to ensure the effectiveness of the drug and not cause any side effects as mentioned previously. And if these conditions are met, the doctor sets another appointment for the visit after 2 to 4 months. In the event that this type of drops does not meet these conditions, the doctor will prescribe another type of them. Advice for patients with high eye pressure: some lifestyle changes may contribute to balancing eye pressure and improving eye health in general. Some tips that can be followed by eye pressure patients are mentioned. Exercise. Exercising increases blood flow to all parts of the body, including the optic nerve and retina. Follow a healthy diet to improve the general eye health. Practice relaxation exercises and avoid exposure to tension and stress, as stress is one of the factors that increase the risk of high eye pressure, so it is recommended to practice meditation and yoga exercises. Raise the head level during sleep, and this helps reduce eye pressure during sleep. For any inquiries or questions, add your comment. And don't forget to subscribe and activate the notification to receive all new